Welcome to MANTHRA Academy online crash course for nurses. Fundamentals of nursing. Part 4. We are going to discuss regarding IV fluid therapy, conversion formulas and burns. So first we can see the IV fluid therapy in that type of IV fluids. This is important, you have to by heart regarding the types of fluids. We have isotonic fluid, hypotonic fluid, hypertonic fluid and volume expanders. Isotonic fluid, that is 0.9% of the saline it contains. Okay, 0.9%. Iso, same like that. So that is example for isotonic fluid, that is normal saline, ringer lactate, dextrose in D5 in water, fresh frozen plasma, albumin 5%. These are isotonic fluids. So you can see here the isotonic means the water is intaking by the cell, like here for the same thing is excreting also here, isotonic. Okay. So hypotonic, 0.45% normal saline. So you can see here, if the water is intake will only 2 molecules and inside the cell it will be 4 like that. Okay, hypotonic. So this is the relation of intracellular and extracellular fluid, sodium pump, and regarding this one it is saying. Okay. So just to know the examples of the types of fluids. Hypotonic, that is 0.45% of NS. Hypotonic means less than 0.9%. Then hypertonic. Hypertonic means more than 0.9% sodium will be there. That is example for that is DNS, 25% dextrose, 50% dextrose. We are using for a hypoglycemic coma and all. Then mannitol, 20%. That is osmotic diuretic. Then 3% NS. These are comes under hypertonic solutions. Then we have a volume expanders. Volume expanders are colloids, as we discussed, the fresh frozen plasma, albumin. Then crystalloids. In RL, in ringer lactate, in burns and postoperative bleeding and all. These are the volume expanders. So these are the types of IV fluids. Next we can see the degree of insertion of needle while administering the injections. We all have administered the injection, different routes of injections. So in that we have to know how much degree we have to give in each category of the medications. Intramuscular, if we are giving, you should give 90 degree you have to give in intramuscular injections. This is 90 degree, okay, intramuscular. And the subcutaneous, if you are giving, you have to give a 45 degree, you have to give in subcutaneous injections. Intradermal, if you are giving for the skin test and if you are giving, you have to give the 15 degree angle you have to give for the intradermal injections. Then tuberculin test syringe, short fine needle about half to 3/4 inches. 25 gauge needle we are using for that. Then intramuscular we are using larger needle, 1.5 to 2 inches long it will be. Gauge will be 20 to 22 is usually using intramuscular injections. So even sometimes in intramuscular you can see that there will be less muscles, thin patients and all. We can't give exact 90 degree. We can give, but the thing is we cannot insert more the needle tip inside the muscles. So in that case, according to the muscle, the mass, we have to insert half of the needle and we have to give the injections like that. Okay, that is degree of insertion of the needle while administering the injections. So what are all are the intramuscular sites? We have a dorsogluteal, ventrogluteal, vastus lateralis, rectus femoris, deltoid. So dorsogluteal or a postgluteal is not used for babies or small children. So for the babies and the small children, we are not using dorsogluteal site. And ventrogluteal, that is a preferred site in the injection in the hip area in this site, both adult and children. So ventrogluteal site is the most preferable site, both adult and children. Then we have a vastus lateralis. Vastus lateralis, it is in the lateral thigh. Okay, we are giving especially for the children, and in some Clexane injections, some subcutaneous injections are we are giving, but mainly we are using for the children. Okay, vastus lateralis, the lateral thigh, this lateral area we are giving for the thigh. Then we have a rectus femoris. Rectus femoris also in the thigh only, but it is in the anterior thigh. Okay, in this area, that is a rectus femoris. And in the arms, upper arm we are giving, that is a deltoid muscle we are giving in the deltoid area.
If you wish to know more details about nursing mantra study materials, feel free to contact me in WhatsApp. Check the description for WhatsApp link.
Next method of infusions, that is a piggyback method. For this method, we have to lower the primary bag to about 6 inches below the secondary bag. So it is a mixed medication bag. So we have in piggyback method, we have two set will be there. Primary set one bag will be there and under infusion also going on. And we are connecting to the primary set to the piggyback back set. Then there will be piggyback port will be there. Then it will be going to the like that. So slowly open the tubing roller clamp and adjust the drip rate. Periodically assess the client during infusion for any adverse drug reaction. After completing the medication, leave a medication tubing on hold for heparin lock. Carefully remove the needle from primary tubing and recap, and for a piggyback method, leave connected to port. If tubing has expired, disconnect and discard it. Insert a needle of a second syringe of sterile saline and inject into the heparin lock. Insert a heparin flush or readjust drip rate for primary infusion. Okay, this is in emergency situations and all want to give more fluids and two medication at the same time and all, we can use this piggyback method. So now important point, that is complications of IV infusions. First complication is IV infiltration. You can see in the picture how it will be. Okay. Do you experience this IV infiltration after the IV cannulation? Your patients experience this? IV infiltration, the clinical features, the area will be hard and cold area, that area will be to touch, and the patient will complain of pain and a burning sensation in that area. Blood does not return in tubing when bag is lowered below the level of the patient. Arm become white and has raised area, edema, everything will be there. What is the treatment for IV infiltration means? We have to immediately discontinue the IV. Moist warm pack should be applied. Notify the physician. For a long-term use of TP and total parenteral nutrition or IV therapy, we have to use Hickman catheter and all to avoid this IV infiltration. Hickman catheter we can use for long term TPN or IV infusions and all. So blanching at IV site, cold temperature at IV site, difficulty flushing and all you can see in IV infiltration.
If you did subscribe Nursing Mantra YouTube channel until now, please subscribe now and enable the bell icon to get updated videos and notification.
So next is extravasation. Extravasation, it is some irritant solution if we are giving that will be leaking in the around the tissue area, or the medications, irritant medications will be leaking into the surrounding tissue as a result of cannula dislodgement or leakage through brittle veins. Irritant solutions such as vasopressors, so like potassium and calcium preparations, especially the calcium injections and all, it will be causing very irritated to the veins. Okay, so chemotherapeutic agents, all these medications will cause extravasations. So while administering, we have to be more take care regarding that. Symptoms of extravasation: there will be swelling, blanching, structured skin, and necrosis, blistering and subsequent peeling of the skin, everything will be there. You can see in the picture. The treatment, immediately we have to stop the infusion. Initiate the treatment protocol including a specific antidote to the extravasated medication. We have to give the antidote for that. Thorough neurovascular assessment of the affected extremity. Do not use affected extremity for further cannula placement. Prevention, avoid inserting IV lines in areas of flexion. Then like that we can do the prevention, or secure the IV lines properly. Use appropriate size of IV cannula and all when we are giving the irritant solutions. These are the preventive methods. Next IV complication is phlebitis. It is the inflammation of the vein wall. Okay, you can see here the inflammation of the vein wall, that is phlebitis. The chemicals irritating medication or solution in having increased pH value and all, that is or a rapid infusion rate, due to that also it is happening. Or mechanical means long periods of cannulation, cannula in a flexed area, gauges larger than the vein lumen, poorly secured cannulas. These are the causes for the mechanical cause for the phlebitis. And bacterial cause means a poor handling hygiene, lack of aseptic technique. All this will lead to the phlebitis. Symptoms: there will be reddened warm area around the insertion site. You can see here, along path of the vein. There will be swelling. Sometimes fever will be there. Treatment means immediately we have to discontinue the IV line and restart it in the another site. Consider antibiotic therapy according to the CBC level. Prevention, aseptic technique, appropriate size cannula, then monitor the site hourly for any complications. Like that we can prevent the phlebitis.
For continuation of this video and more system-wise crash course, feel free to contact Nursing Mantra. WhatsApp number +971 5025 15717. Please check the description for WhatsApp link.